She's Healthier with Orya Care. Welcome to our new podcast, and I'm your host, Arun Patre. We're here to talk about your healthcare needs in a way that's deeply caring, scientific, and honest. Have you noticed how some of the biggest transitions in life for a woman, be it puberty, maternity, or menopause, is all about, sidelining the woman's needs. Puberty is all about leading periods in silence. Pregnancy is all about the baby, and menopause as if it never happened or is just another phase. Well, we at Orya Care certainly think that that's not the way it should be. And there's a way for it to make it more empathetic, caring, and pampering for women. Here's a look at Medicine 3.0 in a way that's preventive and not reactive, in a way that's personalized and not generalized. And this is what we cover in our podcast and our different approaches to how these life stages can be made much more caring for the woman. On this episode of the podcast, we talk about sex, intimacy, aging, and infertility. Well, quite intimidating, but somebody has to talk about them, right? And we have two very prominent gynecologists with us. Let me start with Dr. Lavanya Kiran. She hails from Mandya. She's delivered 20,000 babies till date and close to 650 robotic surgeries. And she's also a cosmetic gynecologist practitioner as well as a laparoscopic surgeon. Coming to Dr. Ashwin, he's a third generation gynecologist practicing in Salem. Welcome to both of you.
Thank you.
So we're talking about how can we bring in some elements of each of these milestones out in discussion. Some of these topics are very intimidating and quite shy for me to bring it in the open. With that note, let me say that doctors, one thing that I have always wondered is, how does one get introduced to the topic of, intimacy? Does that happen in adolescence or much later? For me, I'll just say that, for me, it was a conversation that I had on a terrace that I distinctly remember with a friend of mine. And this friend happened to be, both his parents are doctors. And I spoke to him about the wet dreams that I had for the first time. And that was my initiation into, intimacy and what it was. And he taught me what this is with the explanation of a rocket launch. And that's how it was for me. Maybe you guys can tell me what it was for you.
Yeah, I think this is indeed a right topic you have chosen. And I think this is something to be definitely discussed about. Like Arun said, this is very less spoken about. And I think it's very good to have the right information because that is when it sets the path for you for the future. And when you say, when does it get exposed to people? Is it adolescent? Is it teenage? Or is it adult life? I think the answer remains unanswered because for each individual it is going to be different. But considering the present generation of Gen Z and Alpha, I think it's way before time because when I go for health talks, I see kids as young as 9 years, 10 years know about it. But when you come to a different generation, it's altogether a different thing. Like when you said, a talk on the terrace. For somebody, it's different. For me, I think I've always wanted to be a doctor, and so I think I've been more attentive in the biology classes, and that's how it's been. But then, yes, of course, in school, when you get to hear about, there's the guy touching the girl the next door, the girl sitting right next to him. So that becomes the gossip of the class, and this is how my first thing started on, how does it feel, and those things is my exposure, I would say.
Dr. Ashwin, maybe you could share a little bit more about, was it any different for you in med school? How do you get initiated to this topic, to talk about this uncomfortable topic to your clients? Like I'm feeling that right now to even talk to both of you.
Oh, you're definitely justified in feeling that way because I think all of us felt that way when there was a topic about intimacy and sexuality and everything. I think, what all of us have been brought up in a way of thinking is that intimacy is basically something that you have with a crush or a lover or something. But I feel intimacy comes to the point of when how you feel nice, how you feel safe, how you feel, respected basically is what intimacy actually means because that's how it tells you about how well you can discuss it with your parents, with your friends, or with somebody who won't take it in the wrong sense. So I feel in school, I came from a place like Salem, and then in school we were asked to sit separately, boys separate and girls separate.
True.
And also, what would happen is the
Quite
funny
the opposite today.
exactly, and the funny thing is that when the teacher decided to punish us, they would ask us to sit next to a girl, and we'd feel so embarrassed.
But did you really think it was a punishment?
At that
Those
point
times
of
you
time,
did.
at that point of time, I did find a punishment because you felt so conscious about yourself and how you'd behave, how to act. And then, in case they had to sit very close to each other, you suddenly touch her, your leg touches her, and then you feel like, oh, I'm sorry, I didn't feel this way.
And do you also agree you would be ragged after the class for sitting
Exactly,
right next to
exactly. You'd be
the
so worried
class?
about it.
All the
But
friends would
then,
corner you.
Yes,
exactly,
yes,
and
yes.
when during school, during the younger part of schooling is when I felt this way. When you're much older, your first initiation came right in the toilets, because that is where in the toilet you'd see I mean pencil sketchings or pen sketching saying this one loves so and so, and then that's how you'd get details about what intimacy would be like and what how to feel intimate or how to start liking somebody or loving somebody and how you would actually say I love you and all those things and what love actually means. And that is how it got started in the first place. And then you'd be surprised that none of us actually received much of a sex education
True.
in school.
What
Although
about med school, doctor?
in med school is totally different. I would really say that doctors as such, we would just get exposed to those intimate parts during dissection. The first time actually I happened to see a female genitalia was of yes in during dissection sessions where we would have embalmed bodies there to dissect for the first time and learn about anatomy and everything. That's when we would really first get an opportunity to see, and then your imagination runs wild, and then you start picturing that with other women and say, okay, this is how it probably is, and this is how you'd go ahead.
Tell me, doctor, to talk to a stranger about this topic, which is what both of you have to do day in and day out, because otherwise, that's the way to win over your patient's confidence. How did you get trained into this?
First of all, I have another perspective to what Ashwin was saying. He was talking about medical school and the anatomy dissection. I think the first time that we actually get exposed to a real patient is when you go to the clinical postings. And that is when you actually see a live patient and then you are asked to strip and then see these things. And that's quite thing. Because even in school, like he said, it's such a taboo topic even for a science teacher. And then I remember, like, forget
You'd find them running
boys.
over the topic,
True,
in
true.
fact.
And it's just forget boys and girls sitting separately. I don't know how it was for because Ashwin comes from another generation than
Yeah.
we. But even the class of reproductive medicine would be taught separately. And very few teachers would talk openly about it. I think being into science, we would only want to say, I'm sure Ashwin wants to echo the same, that talking about it is very important. And earlier days are much better. And you were talking about how do we talk about this to our patients and how comfortable are we talking
Yeah.
about. Though we are in the field of gynecology, like post IMBBS, then we do masters in gynecology. I think these things are not actually taught for us in the school days or the career days or your post graduation. It's not thought about. This is something I picked up over the years of practice, traveling to several other countries, getting your affiliations, getting your degrees, getting your fellowships across different countries, visiting different hospitals, made me open up how they were to their patients, of how they were openly talking about it and how the doctor patient relationship changed for them. And I think that is how I learned and decided that the more open you are to the patients about intimacy, the sexual habits or the sexual culture that you need to be following, made me more closer to the patients. And I decided when I talk about it, only then the patient's going to open about it. So this is what changed my perspective, which was much after my training, I would say.
Very well said. Dr. Ashwin, maybe you can tell us a few keywords of how you make that patient.
Basically, what I would like to really tell you is communication is something which is never taught in med school or during MBBS or during masters as well. Whereas Arun, you come from an IM background, and I'm sure that communication is the key to key to
Absolutely.
achieving
Sure,
anything,
sure,
any
so true.
kind of any kind of if you want to really get some kind of project done or something to be pushed through, I think communicating the right things is when you can really make sure that the project is yours.
Yeah.
The same thing is never really done for us in med school or during postgrad as well. And communication is something that I think over time I have built it up myself. Like how you come out of stage fright, it's like you have to come out of sex talk fright. That's
Sex
what you would
talk
say.
fright.
Exactly.
Cool.
Because if you're not able to come out of it, I think just the part wherein your body language shows that you're a little worried or you're kind of inhibited or you feel that you can't really talk about that is something what your patient gets onto as well.
Right.
And then the more confidence you emit, the more likely the patient will actually discuss certain things that they
Yeah.
are finding difficult to talk about.
So, I mean, India is today the world's youngest population. If we don't do this right, then it's quite a public health disaster.
Very
So I'm
much.
sure, thanks to both of you, we will have more gynecologists feel more, confident of addressing this topic. In fact, while I was doing my research on this topic, I went through this Late in India report, which was alarming for me. It said close to 30%, 34% of the people didn't learn about intimacy till date, like even in their adulthood. Whereas 38% of them learned it from their friends.
We don't know the statistics, but definitely in our clinical scenario, when we compare, I think we are almost there.
You think so too?
Yes, yes,
I think I could
definitely.
definitely
Just
agree on
for
those numbers
maybe
because,
more,
in fact,
maybe
more.
more.
Because
So,
again, here during these studies and during these surveys that are taken, not everybody is willing to openly say that they knew about or did not know about it. But I think the numbers are going to be more than what you describe them to be. Is what I would personally feel.
see, like how he was talking about sex or difficulty in having an intimate life. Patients will see that confidence in you. Because see, if as a clinician, if I'm not making an eye-to-eye contact with my patient while talking about sensitive things like about sexuality, about their comfort, about being close to their partners or their difficulty in having a sexual life, if I don't talk about these things on eye-to-eye, I think that is when the patient's not even going to talk about it. Or sometimes you have to understand, get down to the patient level, talk to them, and try to give a leading questions. And that is when they're going to be comfortable trying to talk about these things, and that is when the openness comes.
Because
So
in a
this may I-
clinic, if you look at it,
Yeah.
like as a male gynecologist,
Yeah.
the first thing I realize is how am I even going to get patients to come to me?
I'm sure it's very hard, right?
And how many patients are going to say, yes, doctor, I want to see you. I don't mind being examined by you and I'd be happy. And I came to you because I want you to see me. Initially, I felt that when I started practicing gynecology, I felt most patients who come to me would come to me and say, okay, doctor, please jot down my complaints. Let me get examined by somebody else. Let that somebody else tell you what my problems are, and then you diagnose what I have, and then treat me accordingly. But then you'd be surprised when you are really confident with what you do, and you're able to talk to them with some amount of openness and honesty. How many people come to me, and if I'm not available a particular day, they don't mind going back and coming back again if they haven't taken an appointment. And I'm very clear, okay, I tell them, okay, you come to me, I'm not there, you can see another gynecologist, I can come back and see you much later. And they say, no, I've come to see you and I'll see only you. Which is
you should give
actually
us
a
some of
real
this
pat on my
tactics.
back, in fact, as a male gynecologist.
Indeed.
I would honestly say.
How long did the transition take for you?
I mean, you'd be surprised that it took just about 2 or 3 months.
So what's the secret sauce?
No, the secret sauce honestly is about how confident you are
Communicate.
with
No, I
how you
think
talk to them.
communication is something very important. This is why I said, I think I'm sure you agree with me.
Yes.
Because communication, that confidence, and making the other person more comfortable with the topic. And I think that is the same when it comes to partners as well, where, if the partners are not comfortable with each other, how would they get intimate?
Yeah.
Then we're not calling it intimacy, then it's like the other word, the rape or something is the one, because if the communication is not there, the respect to each other is not there. And it's the same culture that we practice in the clinic as well: communication, respect, and trying to listen to them. I think that this itself is going to solve a lot of problems.
Dr. Lavanya, I think that brings me to the next question of, how do you really define intimacy? Is it just the physical part? What's the
Definitely
emotional
not.
part?
Definitely
And
not.
how is that varied with either partners? like there's a male and a female standpoint to both these aspects. If you could throw some light on that.
Definitely. For me, I would say intimacy is not just physical, it's about emotional, mental, intellectual, and physical as well. And I think I would place physical intimacy as the last, because
Okay.
if you have to get physically intimate respectfully, I think you will have to develop this emotional bondage, this mental equation should be the same, and comfort for the other person to talk about what do they feel about their deepest thoughts, or how are they feeling, I think is the most important thing. So when I say intimacy, though majority of them think about we're talking about physical intimacy, it's definitely not, because intimacy can be in different relationships, like not just the partners, with family members, with friends. So it's an extended thing. So intimacy is something that you're comfortable with the other person, be it emotionally, be it physically, or be it intimately. I think that is what is important. And if we are talking about physical intimacy, and I think it's something, communication is very, very important for the partners, because only when you talk about your deepest thoughts, or how are you feeling about anything, how are you feeling about each other, I think that's what's going to make a difference. And when you gain that bondage, which starts off emotionally, that is when the intimacy can also be more pleasurable, comfortable, and something which both of them share equally. I think that's what is the most important thing, I would say. So
Dr. Ashwin, any real-time examples of how this, distinction between physical, emotional, and the mental part was, seen in some of your clients, maybe?
See, I feel intimacy is something, as Dr. Lavanya had said, is about mutual respect.
Yeah.
So what happens is that how often when I talk to patients, I realize that when a couple decides to have sex, I find that most couples telling me that once the man has his erection and his orgasm, he's done with it and he's out. How often do you really ask your partner whether she had the orgasm as well? That is what I mean by mutual respect. Because, for example, is it just your personal pleasure, or is it going to be mutual orgasm and mutual respect and mutual intimacy? That is what I really need to look into, because that is something that I find with a lot of my patients saying that, okay, the woman comes to me for a gynec consult and she tells me, okay, sir, he just comes home, he's away most of the time, he works in a different place. We meet each other probably once or twice a week, and we decide to have a child, and we do have some amount of intimacy, or we have a relationship, or we decide to have intercourse. The moment he gets it, he's away to his next thing. He decides to go watch TV, he decides to have food, or he decides to sleep. What about me? I'm just lying over there, not knowing what has happened. And in the end, when I decide to talk about him, the first thing that he says, you want to have a child, right? This is how you have a child, and we're done. What about my personal interests? What I feel about myself? What am I in this marriage? And where am I in this family?
So,
It's
Dr.
something
Lavanya,
that,
would you agree that, a man has a different perspective from, a lady in the whole aspect of mutual respect?
definitely more than respect here, I think it's about communication. And I think respect is a part of this communication,
exactly.
I would say.
Yes.
And these examples are something that we see
All
on
the time.
day to day, especially we both being fertility specialists.
Exactly.
It's very common for us. Like, it's more of a mechanical sexual life that
And
they're
there are
leading.
questions which say, what do you mean by foreplay? That is
True.
amazing.
So I wanted to talk about that. So
Okay.
that's when the point of communication comes. Gone are those days. This scenario we see less, but I will not say we're not seeing it at all. Definitely it is there, because I think India at large is consistent with all kinds of people, from urban to rural to semi-urban to semi-rural. So how many of them are open to talk about it to their partners is the most important thing. So when we say that, if the lady is not talking about what she needs, or what is it that she likes and how does she like it, is very important. And until unless they don't open about it, it's not going to make difference. But when would she open?
So,
When she has this emotional connect with
yeah,
the partner,
exactly.
that's
the
when she's
emotional
going to
connect
open.
is the
Yes,
part.
yes.
But do you, both of you, also agree that, does sex education affect intimacy? Like, in the sense, Is it, if you're taught that you don't have to cringe when you talk about this subject, or, you have to be guided to be curious in a respectful way? How does some of this impact intimacy?
think it's a growing movement, in fact. I think talking about sexual education introduction, when are you introducing it? When are you talking about these things makes a lot of difference. I would definitely agree these things should be talked about from the days of school. And anybody who has a education about sexual life or about intimacy will be more respectful to the other person. And not only about intimacy, I think here we are also bringing them awareness about safe sex, which not only helps them limit their partners, also limiting themselves or refraining from early sexual activities, also talking about contraception using condoms, preventing sexually transmitted diseases. I think these are something that we will put early into their brain, because your first question is how early,
Yes.
where anybody exposed. So I think when they have this as an education and somebody speaks about it openly to these people, they'll be aware. So they're more guarded or they're more educated about it, and they take a sensible step is what I would say.
So in that sense, educated in the safe way makes sense for India as a public health effort too, and not just from, an awareness standpoint.
Not only India, I would say across the
Across the
globe,
globe, yeah.
because the number of sexually transmitted diseases, AIDS, lot of other problems, unwanted pregnancies for that matter, multiple partners, cervical cancers, I think will all have to be cut down, and the way to go forward is introducing.
So basically, if the teacher in school who's taking sex ed, who's actually a zoology professor or a botany teacher who's taking a class on safe sex, I think there should be actually a training program for them from a gynecologist perspective. Because the reason why they find it difficult to talk about it is because they're not very sure as to what education they're giving students is the right thing to do or not. And what they feel is that whether educating students on these lines would probably increase the rates of premarital sex is what I feel prevents them from communicating this particular part. But I feel some amount of confidence on their side to tell them that, see, contraceptives is one thing, but contraceptives are not completely preventive. They just have a percentage of how much they can actually prevent the possibility of a child. So once this is taught, I feel personally that curiosity comes a little bit and the worry goes up as to what if unsafe sex or unplanned sex can lead to something which can probably cause a lot of complications, because you do get a lot of unmarried pregnancies these days, and on most occasions over the counter pills available from a pharmacy without a proper consultation by a gynec can lead to a lot of complications. And still feel unsafe medical termination of pregnancy is one of the leading causes of death among young women.
That's quite
So,
alarming.
yes.
Yes.
And in fact, so there you have just busted a myth, which is, sex education causes unnatural curiosity and passions to arise. Whereas
Yes.
we see it's the opposite.
Exactly.
You're busting this myth that,
Yes.
we need to educate right early and safely so that we don't lead into this situation.
We don't lead into this, we bring in the awareness the right way.
Because
That's
the
very
unsafe or unplanned sex is because of curiosity as to what it actually means. If you're able to describe something, or if people are able to see what it actually means, I feel that that curiosity gets killed, and then it's more likely that there is some emotional connect before a physical intimate relationship.
So that also means it is the, I would say, changing the mindset of the provider. So
Who's the provider?
provider is the healthcare worker. It could not just mean doctors, it could be a nursing staff or anybody who works in the hospital. Because I feel patients are a commoner. Anybody who has a problem doesn't mean they always go to a doctor. They could be talking to a nursing staff because they think she's working in a hospital setup. So they would be talking to somebody like this. So the awareness needs to be created with lot of people. So I think changing the mindset of the provider is very, very important. And I'm sure you can remember I'm not sure if you related to yourself, but then I definitely relate when I got into first year medicine. So they assumed that I could diagnose all diseases and I could start
Exactly.
treatment
Start treating.
for
In the first
everything
year.
in my first year. While I was still trying to learn how to check
Exactly.
a BP.
And if you are
and
not able to tell them what is wrong with them,
correct,
they would really
yes.
ask you, you're a doctor, how
Doctor.
come you don't know about this?
Correct, correct.
Then you are I'm not a doctor, I'm a medical student. And it takes me 5.5 years to understand, which
And-
Google tends to give you in a minute.
True. So it takes a lot of effort. MBBS is just putting medical knowledge and then takes your masters of 3 years. And by the time you put it into practice, learn it the right way, what is more comfortable to the patients takes a lot of years, 20 plus years,
Yes,
15 plus years,
definitely.
So I think that's how the practice builds and
It takes a lot of
changes.
time for people to understand as to what it actually means. Because, see, all of us undergo something called training in basic life support. But I think none of us doctors undergo a training on how to communicate
Yeah.
about the basic necessity of life, that is sex, and the idea of reproduction. That is something that none of us have any idea or any clue, whether it's in school, college, or masters, or even once we go into clinical practice. We are not really taught to hand over that knowledge to the paramedical staff so they can do some amount of counseling before the patient comes and sees you.
But do you agree? I think you asked us a question in the beginning. When did your mindset change, or how comfortable? Did you agree? I mean, it was for me the same that once I got qualified in cosmetic gynecology, things changed for me of what all you can treat, what all questions to ask, how to approach a patient. Was it the same for you as well?
I think the
it
same.
was
The cosmetic gynae training that you went through was a real Pandora's box.
ice,
It was
ice,
opened.
ice breaking for us
Yes,
as well.
yes.
Seems like a new word to me. We
Yes.
will talk about it at
Yes,
Orya Care.
we should.
Yes.
Doctors, I have a myth that I am really curious about because I had an arranged marriage myself. But please tell me, is intimacy less important in an arranged marriage because you have more time to know each other?
I will only ask, is it so?
This is the myth.
I don't think so. Mine is an arranged marriage too. But then I think intimacy shouldn't be dependent on arranged marriage and
Okay.
love marriage at all. Or I don't know, the Gen Z, should we ask it as a question of choice marriage and forced marriage? I think should be
So
the.
mine was a love marriage.
Yeah.
So I mean, I have a lot of friends who had arranged marriages as well, but I don't think intimacies change any way in either of our marriages, because when we go out on family trips together,
Yeah.
we don't really feel there's a huge difference in that.
Okay.
What do you feel, ma'am? What do you feel?
But I don't think so. I don't think that changes.
But in your practice, doctors, choice marriage versus arranged, what is the scenarios that you have seen that they come to you with? Are the questions different, or the people who tag along for this consultation are different?
Yeah, this makes it more interesting question, I would say. Um, on the overall, though I said it doesn't make any difference, be it the arranged marriage or the love marriage, it is more about knowing the person. I think when we're talking about love marriages, you have been with that person, you have known them, so you've connected emotionally, and maybe you've had some flings or whatever duration that you spent with them. So you're more comfortable getting intimate, or you're already intimate, and that is how you're choosing to be together for a longer duration time. May not be the same when arranged marriage. It's just that it may take a little longer time from the marriage to getting intimate, but then it also means of how much you have known each other. And I would say intimacy is directly proportional to emotional intimacy as well. So if you have known the person, tried spending time with each other, I think that should not make much of a difference. Per se, clinically, when you say about the patients who are walking into the clinic, I think, well, especially being a fertility specialist, I think we see couple equally facing problems with fertility, be it the arranged marriage or the love marriage. In fact, I've had quite a few couples who've had love marriage, been in relationship for a very long duration, then gone ahead with marriage, also having difficulties in consummating and reproducing, per se, the fertility part. And same with the arranged marriages. And on the same scenario or a different scenario, I would say people have conceived faster in arranged marriages compared to love marriages. More so because in love marriage, I think you're communicating to each other and
From
saying,
before?
yes, in before, and you're also planning your path as a parent to be, or a partner rather, and saying you setting timelines when you're getting married or before marriage. When do we want to have a child? What do we want to do? Are you ready for this? Are you ready for a relationship? In an arranged marriage, I think it depends on how much time you have to
Right.
uh, deal with each other or talk to each other, because in an arranged marriage, I think it's the same even in a love marriage where you're going into an unknown family. It's just the partner is known and the family may still remain unknown. So, getting used to that and going through a lot of emotional changes, environmental changes for the lady, especially, I think takes a little longer time. But then intimacy again can be mutual respect, consent, and forceful as well. So that becomes opens like a Pandora box into a different perspective.
I have a question differently for Dr. Ashwin, although how this intimacy question with the kind of marriage influences that, maybe you can tell us more on that.
See, if you look at my kind of practice, the only difference you see from there, from where Dr. Lavanya practices, where I practice, is that I feel I do things similarly. But if you look at it, see, even if it's a love marriage or an arranged marriage, even in a love marriage, you're transitioning from the phase of being a girlfriend to a phase of being a wife.
Yeah.
So again, as a girlfriend, you're in your own house, you're safe, things are done for you, everything is taken care of. But when you transition being a wife, what happens in an Indian household is that you're suddenly given a lot of other responsibilities as well, other than just being your husband's wife or being passionate or being respectful or being intimate and emotionally connected. So I feel that first few months, whether you've had a love marriage or an arranged marriage, works very similarly, except that in a love marriage, you're kind of slightly understood your husband in a different environment altogether. But you're still yet to understand your husband when he's with his mother. That is the part which is not really what love marriage couples don't really understand.
So should we put it as a supportive husband rather
Yes.
than a love
Yes,
marriage or an
yes,
arranged marriage?
yes. That's the word to go
Yes,
with it.
yes.
I think.
Okay.
So
So it's not the
definitely.
marriage of choice,
Yes.
while it is actually the support
Supportive
element.
partner.
Exactly, exactly. How supportive your
Okay.
husband is when it comes to relationship
Easing
and
it for them.
and respect and mutual understanding, and then whom he is more comfortable with, whether and how much of a stand he's going
In
to
the same
take.
situation.
Yes, and how much of a stand he's able to take, whether it's with his mother or his wife. And there are two contrasting poles like north and south,
Yeah.
which on many occasions don't really tend to meet.
No, that's why I said if it's different scenarios, it's okay. But on the same situation, I think that is where the problem comes in.
Exactly.
And
Being
I'm
supportive,
sure
it's different.
as doctors, especially as gynecologists, you would be caught in a consultation where there's a mother-in-law and
Exactly,
the
exactly.
husband. How do you handle? What is the gynecologist's role to make this north and
I
south
really
pole?
want to take this one first before ma'am does, because what
All yours.
happens is that in my clinic,
Yeah.
when in a place from where I come from, whether it's a love or arranged marriage, generally the consultation of a couple is not really understood that well. They feel that their parents have to be brought along for the consultation as well. A decision is never made by just the couple. That is why what you find is that 3 months down the marriage, the in-laws come in with the daughter-in-law and the
Yeah.
husband and say she is not able to conceive. Like what they tell you is okay. And the first thing is like I had my first child when I was 1 year through my marriage.
Much
At the end
earlier.
of 1 year, I delivered the child, is what most of them tell me. And then they come and tell me they are now married for 6 months and there's nothing, there's no good news. That's the word they use, no good news. I've come to you for a consult and to help me obtain the good news. It's like as if I'm saying
You're
like I'm
thrusting
saying
all
tatastu.
responsibility.
I say tatastu and the child is born. Lo, the child is born. That is something that they still need to educate them that there is something with regard to career paths as a professional and career paths as a family.
Ma'am, would you agree the same as to what's the doctor's role in counseling the family on this?
On the overall, yes. But then for me, I think considering or taking the advantage of my age, I become three generation doctors. So more of a family doctor you become, because I would have treated the mother or the mother of the bride or the mother of the groom for hysterectomy or gynec issues, and now we have the
Pregnancy.
newlywed couple and somebody in the family would have delivered, and those kids are coming for vaccinations. So you can already guess what my age would be. So this is how
I
three
did
generation.
not.
Thank you for that. So so it's like three generation doctors. You become a family doctor for them. So it may not be a typical consultation and coming and forcing,
Yeah.
but then I do agree, and that also means I have people coming from different sectors. Though you mentioned I'm sitting in the Silicon Valley, sitting in an electronic city between the IT hub. I also have a lot of patients coming from the rural sectors and from different parts as well. So I understand when you say we have. In-laws or the parents even in fact coming along with the couple and asking the same question of forget 3 months. I was surprised because I have a lot of couple who come back, especially more than the couple, I think it's the in-laws who come back and say it's already a month and nothing has happened. And I also have, because majority of my clientele is the IT crowd, so I think they're more matured enough, and we also have a different statistics or the other end of the spectrum. I have where couple come in even at 30, 35, married as long as 8, 9 years, coming back to me and asking, I want to postpone my pregnancy for another couple of years, or we're not even looking at children. Or I also have couple who do not want to be physically intimate. They're very happy as partners, as emotional intimacy and intellectual intimacy, and definitely not. So I have couples of all varied kinds, but then just the question of mother-in-laws or the mothers or the parents coming with them is quite common, not uncommon. But then we have couple who take decisions for themselves and talk for themselves as well.
The same thing with me as well. What I would say is, since I'm a third generation gynec, people who have been delivered by my mother or my
They come to
grandmother
you.
tend to come to me, but with a different thing. Like the girl's mother comes to me saying that I have two daughters. The first one has been married for 4 years. The second one has been married for 1 year. The second one has achieved pregnancy, where the first one has not achieved pregnancy yet. They tend to set up a competition within the family as to who reaches the target first. And in case the younger one reaches the target first, they make sure the older one gets to know about it, and they put forward the question to the older one asking, why haven't you achieved this? What is wrong? They even talk about intimacy and sexual relationship for the first time with the older one only after the younger one has achieved pregnancy ahead of the older one.
Well, this is quite a stark contrast when, in teenage or adolescence, Indian parents are very shy about, this topic. Whereas when it comes to this juncture, it seems quite different.
Yes, they talk about it then for the first time.
But that's because I would say it's a social obligation, because I think still in India, far say that having a child is more of a social obligation than what do the couple actually want. So especially for the family and the elders in the family, it's like a statement that their
Status-
son have
status symbol.
status, or a statement that their son has been able to reproduce, or their daughter is fertile and this is why they've achieved a pregnancy at the earliest. So I don't think that thing is gone in, but of course, like I said, it depends on your brought up, your exposure, and what your personal thinking is. But far say we do have lot of percentage of people belonging to this category, and this is why the family forces the couple
Yes.
to have a child much earlier.
And even if the girl wants to postpone her pregnancy, the likelihood of them undergoing an IVF, even without a reason, could also mean due to stress behind this entire situation of putting so much pressure on the girl for not being able to achieve pregnancy, not being able to have a child. And the first thing the mother of the girl comes and tells you is that I'm not able to go out to any parties because the first thing that my friends ask me is, when is she due or when is she going to achieve pregnancy? Is she ever going to achieve pregnancy? But what they don't understand is that different couples have different targets in mind. It's not necessary for every couple to achieve pregnancy. They can also think of not achieving pregnancy, not having a child. It is something left to them to decide about how to go ahead with their lives, which is something that puts enormous stress on them.
I think that's a very evolved statement for us as a society to kind of maybe accept that. But with changing landscape in the society, I'm sure we will evolve to that. That brings me exactly to that question. How do we define fertility? And often that we hear about the myth is it's a women problem. Ma'am, please help us get
Definitely
the
not. Because for me, I would say fertility is a natural way of reproduction where the couple can conceive or consummate and have a you know normal reproduction within a year of marriage or within a year of consummation, I would say. And here, things would change if you're a little older person, like more than 35, then we would definitely want to say, come in early at the end of 6 months, and then you need to be worried, or if you are worried. Right? So that also says that we need to respect the other person. Because I think choices have changed now.
Yeah.
Because people want to postpone their pregnancies and their priorities have changed with education, financial independency, and all. But I'm sure the women are sensible, and it is very much needed to be sensible to thinking of postponing the pregnancy only till the right time and not unnecessarily postponing too much, because there are a lot of things associated with the age and a lot of these things. And this is also a sad scenario, like how he said, the family is forcing the couple to conceive to a extent that we have couple married for 3 months, 6 months because of the pressure of the family or the friends. They come in and say, I'm ready to go through an IVF because we can't go through the stress and especially the social engagements that they are involved with, how they are getting questioned, and they want to push themselves to any kind of treatment modalities. Again, on the other side, we also have girls coming in at 30, 35 saying, look, I want to postpone my pregnancy at a later date or until I find the right partner. I want to do fertility preservation. So I think these are all something that we need to educate the community and bring in this awareness that modalities are there. Just important to talk about it to the right doctor that you want to see.
So maybe as doctors, this is very common to you, but this is the first time I'm seeing this angle of, infertility. They adopt this just due to social pressure because they're not able to, live up to that situation. Whereas I always thought, as somebody who's watching this industry and generally our lifestyles which have led to infertility, you think that's not the only factor.
That's definitely not the only factor. And you also brought up a question that, is it just the females who are the cause of a fertility? It is not, because I think it's equal for both of them. In fact, I would say 30% female factor, 30% male factor, 30% both of them. And we have something called the unexplained one, which is contributing to 10%. So it's like everything together as a couple on the whole who needs to be evaluated and not just one person per se.
Exactly.
So,
But how
And
much
another
of
point I'd like to add to this, which I feel is very important, as Dr. Lavanya had said, 1 year of proper intercourse or proper, but intercourse done the right way. You don't know whether done the right way or not. Have they been even taught what the right, which door to approach, which door to open? Am I opening door number 1, 2, or 3? That's the most
so
important
very, very,
thing.
very true.
I mean, this is
think-
reminding me of the movie Dr. G and Ayushmann Khurrana's counsel of how he understood this situation for a client.
True.
कोशिश करते रहिए, बच्चा जरूर होगा।
एक साल में 116 बार निशाना साधे। समझ में आ रहा है आपको?
आप गिन रहे हैं, इन्हें सही जगह पता नहीं है, ये गलत जगह घुस जाते हैं।
Exactly.
We have a lot of people who come in non-consummated marriages because of a lot of pathology involved or psychological problems involved, and that's a different thing. This couple, especially when I asked them, do you have a penetrative sexual contact? They said yes. But then when I examined her, I couldn't believe that the hymen was intact.
Hymen,
So
yes.
the way they were doing was the wrong way. Neither the girl had any idea about it, nor the male partner had an idea about it. So I think the right sex education is very important, and that is how we can save a lot of couple with these emotional traumas
Like
or the family
not
trauma.
having proper sex education has led to so much traumatic sex. I mean, no, improper sex leading to not being able to have a child. So much of mental trauma, so much of pressure. Why? Just because it all goes back to the point of saying improper sexual education. I feel that is so important when it comes to this particular statement, sex education.
Dr. Ashwin, this is more a pointed question since you're a male gynecologist. Also, this point of view of a male. Mostly women have felt, made to feel that it's their problem. And also the man in the relationship tends to be dominating about how this is not addressed. Give us some pointers to, fellow doctors. How should they counsel this? And, to the male patient.
Counterpart, exactly. So see, basically they need to understand, any couple trying to achieve pregnancy need to understand that there are four basic points. One thing is, as far as the female is concerned, the ovarian reserve, the uterine factors, like so if there's nothing wrong with the uterus, but the uterus is perfectly okay to have a child. And the third thing is the fallopian tubes, which is actually the natural incubator where the child is actually incubated before it comes into the uterus. And the fourth most important thing is the sperm count. The sperms are okay. And again, to decide to clap, you need both hands. You cannot just say that woman is all important or the man is all important. It's basically having all factors intact. I mean, forget about unexplained infertility or combined infertility. Just a man and a woman being okay on these lines can also achieve pregnancy, provided they are doing it the right way.
In fact, I would say some scenarios I'm sure you would have faced the same, where couple come in and the male is not okay to do his analysis or get examined or even to be spoken to and ask, have you done your evaluation? The female would have gone through so many investigation, couple of visits with lot of doctors, and of course if anything missed we will ask as a fertility specialist. But then equally at that point when I ask him, have you gone through any evaluations or you need to do these things, I've had prompt things and say like, doctor, you get her test done first. If nothing comes out, then I'll think about it. Or, I've had scenarios where the male says, there's nothing wrong with me. I don't want to do my test. You just check her. I'm here and I've got her for you to check her. So, still those scenarios are there. So, that is where the education comes in for the couple to understand the problem could be with anybody. And as a clinician or a gynecologist or even a fertility doctor, we are not here to pinpoint and say, whose problem is it? We are here to address the problem and to find solution. I think that is what the people also need to understand when they come to a fertility doctor.
In that way, as a male gynecologist, at least I find a few husbands coming to me and telling me, Doctor, I would like to have my semen tested just to be sure. I do have that kind of patient as well. And as Dr. Lavanya had said, you do have certain persistent husbands who feel that I'm Superman. And
Except that you didn't wear your costume right.
exactly. Or you've had very tight underwears on your pants. That's why that's preventing you from having a child. But that's something that when a lot of counseling can help. And in certain situations, doing the woman's test first and telling them that, okay, the woman is absolutely okay. And since you had issues with achieving a pregnancy, getting the guy to get his semen tested actually can be easier once you've told him that, okay, the woman is okay, but just to be sure, we'd like to test you as well. So keeping him comfortable and keeping his masculinity intact is what really helps.
Definitely, I would definitely acknowledge those men, and we've had scenarios where you said they volunteer to say, "Doctor, do you want me to do any investigations?" And yes, couple of scenarios how Dr. Ashwin mentioned, we've had only the male partners come in first for whatever reasons. Either they've had multiple partners in the past or whatever reasons, they come in to say, can you do my check? I'm planning to get married or I'm planning a pregnancy. So, yes, we should acknowledge those kind of men. And others who are not, I think, should get up for that.
And think you, I mean, you need to be really happy on those lines that those are the guys who really respected the woman, who feel that they could also be a cause for her stress, in fact, about not having a child. But those guys are the real heroes, is when you really tell them that they are willing to come and get tested. And when men come and say, okay, we have been having intercourse frequently and I'm not so happy, I feel my erection is not very great. Or if he tells, okay, I ejaculate even before I go in. So that takes a lot of courage from the man's point of view to come and acknowledge that there is something wrong with him and he would like a consultation based on that.
I would definitely agree. And then I would say the scenarios have changed. The percentages of couple reporting this or the male partners reporting this is definitely increased. And I think this is all because of the awareness that has been created, because the male also could have a problem. And I think that's very much important.
Do both of you agree that, most of us have been made to believe that it's only lifestyle changes that causes to solve infertility? As doctors, do you want to must bust this myth?
Simple factor, I would say no. Definitely, lifestyle is one of the factors changing a lot of things like stress, and especially westernization of our Indian culture, leading it more to the wrong pathway, rather, I would say, and affecting the fertility. Like I already mentioned, education, financial strength, independency, postponing pregnancies, not going actually in the right direction, I would say, until unless they're looking at fertility preservation and talking about it of how, when, and how early, I think makes a difference. Along with that, I think Ashwin already mentioned the factors as a female and the male, because there could be causes in the uterus, the ovaries, the tubes, and a lot of endocrinological problems or a hormone going haywire. Those needs to be checked. The ovarian reserve is important. Similarly for the man as well, I think the semen analysis, lot of hormonal changes even in the male, I think makes a lot of difference. And sometimes, as fertility specialist, I always say we play gods. We can only play gods. We can't become gods. And whatever said and done, there are some 10% factors where none of us can help them. So these are a lot of things are there. Immunological factors, so many things, that would take an entire day for us to discuss on the causes of fertility. So multiple factors. Lifestyle is one of the factors, and definitely people need to work on their stress levels, especially with the modernization of the work and the targets. I think stress has become one of the major factors. But then, yes, there are multiple factors for the couple not to conceive.
Please, Dr. Ashwin, your concluding comments on what
Lifestyle.
Dr. Lavanya said.
See, lifestyle also means about talking about personal habits like smoking and alcohol, which makes a huge difference as well. It also makes a difference when it comes to personal relationships, sex, and everything, and reproduction as well. And we found that smoking and alcohol and obesity makes a huge difference with the reproductive outcome and also with physical intimacy as well. So I feel lifestyle is a very important factor to think about and shouldn't be just set aside saying that doctors can do everything. I feel some introspecting about what you can do in your personal life to make a difference to your family is also important. So I think that is what I would say regarding lifestyle.
Well, that was our blueprint that we just started out for women's healthcare and medicine 3.0 in India. Do listen to our continuing episodes of She's Healthier with Orya Care. I'd like to thank my podcast editor, Amulya Narayan, and our video person, Nikhil P, for all their support. Do like, share, and subscribe to She's Healthier with Orya Care. See you soon.